You're listening to SportsMed Utah Doc Talk on ESPN 700. If you have a question for the doc, dial in at 877-353-0700. Now back to the show here on ESPN 700.
Welcome back to Doc Talk, 877-353-0700. That's how you can call us here on Doc Talk. Give us a call. Dr. Lyman and I sitting by, ready to take your calls, your questions, your concerns with your body. What's one of the more common injuries you find with the hip? Is it the torn labrum? Is it just a mild strain? Are there different pockets or issues that form with bacteria? What are some of your common issues with the hips?
Yeah, I think the number one problem with the hip is bursitis, which is inflammation of the bursa on the outside of the hip, which usually leads to patients telling me they can't lay on that side because it hurts. And then in my practice, it's very common to see labral tears, just because I'm getting referrals from other orthopedic surgeons because they don't want to deal with this problem, because hip arthroscopy is a difficult procedure to do, and it takes a little extra time to do it. So a lot of people tend to steer clear of it, but I really enjoy it.
Yeah, we were talking about that hip
arthroscopy.
Arthroscopy.
Yeah,
we were talking about that.
Yeah.
And it's something that's extremely rare here in the state. It's kind of rare in the country, right, to find a doctor that's really trained at doing that.
Yeah. I mean, there were doctors starting to scope hips in the 90s, but it really didn't catch on until about 7, 8 years ago. And so the doctors who were already out of residency didn't want to didn't want to start doing a procedure that literally it's recommended that you do 30 of them before you really know what you're doing and can do it efficiently. So that's it's one of those procedures that has a high learning curve, and so not a lot of fun to just pick it up and start in the middle of your practice.
877-353-0700 to give it a hold of us here on Doc Talk if you got a question for the doc. At what point do you know you need to go in for a
hip arthroscopy?
No, for just a complete
exam.
No, for a complete new hip.
Oh, for a hip replacement.
Yeah.
I think you have to have arthritis on the X-ray. You don't replace a hip unless you see that joint space narrowing, the bones are coming close together, and then of course groin pain almost always accompanies hip arthritis. So the kind of pain that patients come in with, that pain on the outside, the lateral hip pain, the bursitis, they come in, they're so worried they're going to have a hip replacement, and then we take an X-ray and I tell them, just do some physical therapy, strengthen those hip abductors, the rotator cuff of the hip, just strengthen it up, and you're not going to need a hip replacement, and they're happy.
If somebody does need two hip replacements, is it best to do them at the same time? Do you got to wait a while between the two?
You got to wait a while. We don't do them on the same day usually. Yeah.
877-353-0700. Let's jump out to the phone lines. Cody, you're up next with Dr. Matthew Lyman. What's your question for the doc, Cody?
Yeah, it's not a hip question. I got a shoulder issue I've had for 2 months now. You guys have been talking about the bursitis. Some coworkers of mine have mentioned that might be bursitis. But when I bench, I work out a lot. I'm 30 years old. But when I do a bench press, I get some pain. When I lay on my right side, I'll get that pain. I just recently went to an orthopedic surgeon in Orem, and he mentioned it might be a pec strain, but I'm really not sure about that.
Okay, so did you get an MRI?
No, he took some X-rays. Everything looked fine there. I asked him if he could tell if there was bursitis through the X-rays.
Yeah, he can't.
Personally, I just felt like he didn't really take the time.
Yeah, well, the most common problem with the shoulder is impingement, and where you're telling me that you do a lot of working out, it could just be that your deltoid is strengthened more than the rotator cuff muscles, and that can lead to impingement. And so I like to think of the shoulder as a golf ball on a golf tee, and the mechanism that keeps that ball on the golf tee is the rotator cuff. And the deltoid is always trying to pull that ball off of the golf tee. So the shoulder is very mobile. It's an unstable joint, really, compared to the hip. If the rotator cuff is strong, however, it won't be unstable. And so probably your deltoid is stronger than the rotator cuff, and you just need some specific training.
So like
some
the front deltoid.
No, just the entire deltoid, which exerts
the
a
whole.
superior force on the humeral head, and that can cause it to sublux. And then the rotator cuff gets pinched between the humeral head and the acromion. And the way to fix this is directed strengthening of the shoulder, just to very specifically strengthen the rotator cuff.
Okay.
Are there any exercises you could suggest to try to strengthen that rotator cuff?
Well, again, on the air, it's difficult to describe, but you try to strengthen the rotator cuff with elastic bands without activating the deltoid. And so basically you keep your elbow at the side and use those bands to rotate the arm forward and
do
backward.
some of those abduction and reduction.
Not abduction, it's a rotation, an internal and external rotation. But, these things are all on YouTube. Just
On YouTube.
Or go see your doctor, better yet. Get a physical therapy referral.
What should a YouTube? If he's just looking to try to fix this himself in the next month or two, just see if he can get any type of change. What's the best thing to YouTube to look for those movements to exercise that?
Yeah, just home exercises for rotator cuff strengthening.
Okay, so you think it's the rotator cuff?
From what you're telling me.
Not like a pec strain. Because when I do like lat pulls or pull-ups, that even affects it.
Yeah. What about overhead activity?
A little bit, but like when I do barbell curls, that will even affect it. So I don't know if it has something to do with where the bicep attaches to the deltoid, where it comes up into the shoulder.
Yeah, it could be biceps tendonitis.
Yeah, it's really strange.
Would that feel as if it were a shoulder injury if it was bicep tendonitis?
Yeah, you have some tendons right up here in the shoulder that can get irritated with the kinds of activities he's describing. So with impingement, usually overhead activity is the main complaint, but it sounds like you've got something else going on.
Like that other caller, I live in Utah County. Do you have anyone to recommend for a shoulder, like the two brothers for the hips?
Yeah, that's a good question. I don't really know anyone down there that.
Okay, where are you located?
I'm up in Davis County.
Davis County.
Mm-hmm.
Well, it might be worth just driving up there and getting it looked at by someone that knows what they're doing. Because the guy I went to just really didn't take the time to.
Yeah. My partner, Dr.
Like
Watson.
he blew me off.
My partner, Dr. Watson, does the shoulders in our practice. So I'd make an appointment with Dr. Thomas Watson.
Yeah, Dr. Watson's as good as it gets, man. When it comes to a guy that really does care and knows his business, Dr. Watson is as good as it gets. And like Dr. Lyman said, he is partners with Dr. Watson. What is your clinic number, Dr. Lyman?
801-773-3900.
Did you get that, Cody?
Yeah, what's the clinic? What's the name? So I'm driving. I don't.
It's Davis Orthopedics and Sports Medicine.
Davis Orthopedics. All right, well, I'll just look you up and try to make an appointment.
All right,
next
sounds
week.
great.
All right, bud. Appreciate it, Cody. Good luck on that.
Go Utes.
Go Utes. There you go. Thanks, Cody. Thanks for the call. Again, that number for Dr. Lyman and Dr. Watson, 801-773-3900. That's 801-773-3900 if you want to get a hold of them, if you got an issue and you want to move forward with that. Appreciate the call, Cody. Appreciate all the calls. We got phone lines open, 877-353-0700. That's 877-353-0700. We'll come back right to your phone calls. So line them up. That's all next here on Doc Talk.
This is SportsMed Utah Doc Talk on ESPN 700, your weekly opportunity to talk about your sports injury issues with an expert. Now back to Hans Olsen and the Doc here on ESPN 700.
Big thanks to all the callers. If you've got issues out there, 877-353-0700. It's Doc Talk, and it's the most popular doctor next to Dr. Watson and about 15 or 20 others. You'll take a backseat to 15 or 20 others, right?
Oh, yeah, thanks. I feel great.
No, you're awesome. Dr. Lyman does a heck of a job. We have a lot of fun here. So line them up, 877-353-0700. Whatever questions you may have, let's jump out to the phone calls. And Scott, you're up next with Dr. Lyman. Scott, go ahead.
Hey, thanks for taking my call. The reason I was calling, about a month ago, I got up in the morning and I was putting on my socks, and on my left foot, on my big toe, I just got this screaming pain down the top of my foot and across the top of my big toe. And it doesn't hurt most of the day when I walk around unless I'm going downstairs. So if I push my foot down like I'm pushing on my gas pedal, I just get that screaming pain across the top of my toe. And I was wondering what it might be and what I might do for it.
So it's only activity related?
Yeah.
And it's just when you're going down the stairs and you're firing your gas stroke? So do you have any back problems?
I have had in the past, yeah.
Yeah, because it sounds suspicious for a disc herniation. If you haven't had any trauma whatsoever to the leg, I would guess that a disc herniation could be, it would be on the top of my list.
A what?
A disc herniation in the lumbar spine.
Oh, a disc herniation.
Yes.
Oh,
mm-hmm.
I thought you were saying one with disc herniation. It's like, what is a disc herniation? So a disc herniation could actually cause toe issues?
It can cause pain. No real, deformities, obviously, or anything, but just pain across the top of the foot or in the great toe. That sounds like an L5 nerve root impingement, and so that could be identified with an MRI. And also with those disc herniations, 80% of them do get better without any surgery. So anti-inflammatories taken as often as possible. If it's ibuprofen 3 times a day, I take 600 milligrams a day when I recommend that, and do that for several weeks, and this whole problem could just go away and stay away. And that's what 80% of them do, those disc herniations. So I'd give that a try, some anti-inflammatories.
Great. That sounds good. Thank you very much.
Does that make sense, Scott?
It did.
All
It
right.
did, yeah.
So, that's interesting. That's the funny thing.
Thank you very much.
Yeah, you bet, Scott. Thanks for the call. That's the funny thing about the body, isn't it?
Yeah, how it's wired.
One thing could lead to the other.
How it can refer pain. It's very interesting. Another thing a lot of people don't know is the hip can refer pain to the knee. In medical school and in residency, they would teach me that knee pain is hip pain until proven otherwise. And so I see that once a week, patients coming in saying, my knee hurts, and it's their hip. I just replaced the hip on a guy that just said, my knee hurts. Didn't have a hip problem at all. Take an x-ray, and he's lost half of his hip to bone loss.
No kidding.
I mean, it's just destroyed. His hip didn't hurt. His knee hurt.
His hip showed no pain, though.
No pain at all in his hip.
That is the strangest deal.
Yeah.
So the body does weird things. I know the first time I got a stinger and it blew my hand up, I thought, what in the heck? Most of the pain came literally in my fingertips and in my palm.
Yeah.
When I hit that stinger. Lost a lot of the mobility, a lot of the strength, but it's kind of strange how things are wired up.
Yeah.
How does that hook into the foot? I don't understand how a disc herniation could affect the top part of the foot near the big toe.
Yeah, so it's just that's where the body is reporting the pain to the brain, because the nerve that reports from that part of the foot is getting pinched up in the spine. And so it's screaming at the brain, and the brain says, your foot hurts.
Which is that L5.
Yeah.
Look, that's what I love about doctors. You guys know it all. It's good stuff. 877-353-0700. If you got a pain or if you got an issue or an injury, give us a call. Something that's nagging you, something that's been around. You don't want to deal with this through the holidays. Give Dr. Lyman a call, and we'll see if we can get you hooked up, get you straightened out a little bit. 877-353-0700. That's how you call us here on Doc Talk. Again, that's 877-353-0700. We'll line up the phone calls and take your calls next here on Doc Talk, ESPN 700.